All right. Good evening, everyone. Thank you guys so much for joining us. We're going to give one more minute and let people get on. I know the link got emailed out, so we just want to make sure everyone can get on. So we'll start in about 1 minute. Sorry. All right. Why don't we go ahead and get started? So again, thank you guys for joining us this evening. Everybody that could make it, we appreciate it. Um, Welcome to our first Tri Alliance Town Hall. We are so glad that you guys are here. Our goal tonight is to talk about the collaboration between our 3 state associations and how we believe that we are better together. So we'll each talk about our own legislative agendas for the year, and then some things that we're doing collectively together. And then we will have a question and answer at the end. We do have you guys' microphones muted. So if you have questions, feel free to drop them in the chat. And then at the end, when we have time, we'll go over as many as we can. Yeah, so why don't we go ahead and get started? So to introduce ourselves, we're going to talk about each of us. This is our team. So I'll let Rebecca go ahead and introduce herself first.
Hi everyone, I'm Rebecca Griffith. I am the APTA Colorado president. I have been in this position since October, and I'm really excited to be having this event with Molly and Jesse. I'm really excited for what the future holds for us to work together.
Thanks, Rebecca. I'm Molly Hahn Floyd. I'm the Occupational Therapy State Association president. I'm also very excited and grateful for this alliance and excited to see what we can do together. I'm down in Colorado Springs and currently work in pediatric care.
Okay. And my name's Jessie Hogan. I'm the president for CASHA for speech. Also, yeah, very excited. I feel like this is a long time coming. So I'm glad that we could, all 3 of us, get together and do something like this for all of our members. I live in Fort Collins and I see a lot of babies. That's my specialty. I also own a private practice with 3 different locations. So all right, so I'm going to get us started. I'm going to go over some of the speech agenda items that we have this year for the legislative session. Our biggest one and most controversial will be the SLPA bill. So currently, as it stands, speech language pathology assistants are authorized through the department, the Colorado Department of Ed, CDE, legally to work. Outside of that, technically, legally, SLPAs are not allowed to work in anything other than the school districts. That is not what's happening across our state. There are SLPAs working in every other setting. And I have a feeling, which is why CASHA has stepped in a couple years ago, that most people don't know that. And by judging by the amount of emails that we have gotten most recently, but even over the past 2 years, people just asking that clarifying question. Yes, SLPAs cannot work outside of the school district. So CASHA stepped in and said, we cannot leave this as a gray area. Last year, we tried to do a Sunrise application that got not denied, but they said they were not recommending certification or regulation of SLPAs because we were not able to show cases of harm. We can't show cases of harm in Colorado because there's nowhere to report cases of harm. And we explained that to them, but that wasn't good enough. We were able to show cases of harm in other states. So we took it a step further. And at the beginning of this year, it was one of the first bills introduced. We are running a bill to require DORA just to regulate SLPs outside of the school districts. So it has passed in the House. It is now awaiting testimony on the Senate committee, and then it'll go to the Senate floor. If it passes in the Senate, the governor, we've already spoken to the governor's office many times about this, and it is very likely that he will also sign off on this bill. So it should become law. And if that happens, it will take effect in 2026. So that's our biggest legislative agenda. The next one is for 2025, PTOT and speech. So we're each going to talk about this. Are for outpatient speech therapy, PT and OT. We're up for a rate review. So that's a committee, a Medicaid committee that will determine what our rates will be set at. Not for the next 5 years because those rates will change, but kind of as a baseline. And I know our lobbyists are on here, so if you guys want to speak a little more fluently to that, you can. But that's something that all three of us have been working on. And for the speechies out there, you guys should have gotten a survey from ASHA. So thank you to all who filled that out. That is going to give us very good information that we need to go and present so that we can show just why our services are valuable and why we need an increase in those reimbursement rates. And then lastly, the interstate compact that's been like the never ending journey for everyone. So in Molly, I love that you're giggling. In At the annual convention this last year in Seattle, we met CSAP as all of the state associations, and ASHA updated us that yes, they are still working on it. They're still trying to figure out the logistics, but that they anticipate it happening sometime in early 2025. We're already in February, so let's all cross our fingers, but it should be happening soon. And I know they're getting a lot of pressure from the 34 states that are participating in this to make it a law. And well, it is a law to make it actually functional for us to use. So details are being finalized, and we will let all of you guys know as soon as we hear anything. So that's kind of the update for speech. I'm going to pass it on to OT. If you guys have any questions, just please put them in the chat.
Thanks, Jesse.
Yeah.
So we've been working on a DME bill. Last year, the PT Study Association put in their Practice Act to be able to prescribe DME without a doctor's order. Brilliant. We are following suit and trying to do the same. It has made it through the House, and we have it is going to be presented to the Senate committee in March. So Tim has been great helping us with that. Helping us with collaboration, and I'm very grateful. Rebecca and Jesse, a huge part of this has been getting their support as well. We've had a little bit of opposition, so I'm grateful for that. And rate review, Jesse has discussed that. Same, nothing different. Jesse has given us a survey that Kasha sent out, and we will be sending that out as well to all of our occupational therapy practitioners. If you work in an outpatient setting and you accept Medicaid, please respond, or please be willing to join our committee. You should also be receiving an email shortly about that and being able to join, so that way you can have a voice and be a part of these meetings as decisions are being made on what you could be reimbursed. And then dry needling is something that's in the works. There is a very passionate group of occupational therapy practitioners who would like to get dry needling in our scope of practice. And we've just had a meeting last week on steps we could take to do that. And they're on their way. So we're also doing the same with pelvic health and just seeing what occurs and what happens. But that would all be for 2026. So our big thing this year is just our DME bill, and then working together on the rate review. Take it away, Rebecca.
Okay, so I'm really excited about our legislative agenda for this year. Last year couldn't be beat, right? Because we had our PT Sunset Bill. We came out of that with prescriptive authority for DME, in addition to another long list of amazing changes. So for this year, we are looking at some specific topics to try and tackle. The first one is sports physicals. So in the state of Colorado, there are many, many providers who are authorized to complete sports physicals for our high school athletes. Unfortunately, physical therapists are not on that list. Chiropractors are on that list, physician assistants, nurse practitioners, physicians. But while we are able to contribute to return to sport, we have not yet been allowed to contribute to initiation of sport. And I would argue that we're probably What are the best professionals to be taking that on? So we are going to be running a bill to add us to that roster of appropriate approved professionals so that hopefully by this fall season, sports season, every physical therapist could be providing sports physicals. Where we are with that, there's not a bill number yet. We do have a bill sponsor and we are waiting to have that be introduced. So keep your eye out for that. We will continue to communicate with you to ask you to contact your legislators to tell them why you're qualified to do this. And if you feel particularly passionate about this topic, please feel free to reach out to me directly. We'd love to have you testify on this topic when it's time. But I'm pretty optimistic about this from the conversations I've had so far with other professionals and the legislators that we've talked to already. People seem very receptive about this, so I'm hopeful. Next, just similar to speech therapists and the occupational therapists, we are looking out for you and our Medicaid rates. However, I would say that we are perhaps not super optimistic about us being successful with changing our Medicaid rates as the state is facing a $1 billion budget shortfall. And it seems likely that those cuts are going to have to come from provider rates as well as education. And as federal dollars continue to shift and change, we're concerned. So we're highly concerned that not only are we doing this rate review and advocating for a rate increase, we're going to continue to push that as hard as we can. I just think we need to temper our expectations in the setting of everything that's happening politically, but we are continuing to fight for you. Another piece of Medicaid that we're trying to address is the documentation burden. Plan of cares do not require physician certification at the Medicare level anymore, so we are really fighting to have that requirement removed from our Medicaid plans of care as well. So that is another process that we're working towards that may or may not happen this year, but it is something that's in discussion and we are trying to move forward to alleviate some of that documentation burden for you. And then lastly, our workers' comp credentialing. So the workers' comp process is going through its own sunset, and so it is being reviewed. As part of that, we're advocating for physical therapists and physical therapist assistants to be credentialed as level 1 providers. And that would allow us to be able to not only access more patients, to be able to serve more patients that are wildly underserved in this patient population, but also to increase our reimbursement for these patients as we begin to see them. And then the other thing that I wanted to just mention that's not on this slide is that last year when we went through our sunset process, we were really successful. And the next step is what's called rulemaking. And rulemaking is where we say, hey, now that you can do this thing, what are the parameters around that? So APTA Colorado is taking a very aggressive and proactive approach, and we are going directly to the board with our suggestions about how we think these rules should stand to allow us the maximum scope possible, as well as clear guidance for our members. So we are going to be involved in that process and continue to monitor that and give our input at every possible turn. So those are the biggest things that I'd like to share with you today, and happy to field any questions about any of those items. And as we have bill numbers, we will continue to communicate with you. We are beginning the testimony process tomorrow for our workers' comp credentialing, and we'll be sure to share what I hope will be a clear success.
I love it. Thank you, Rebecca. All right. So the next thing that we just wanted to share with everyone, and this is something that all disciplines do every year. We have a day at the Capitol. So these are the dates for speech, occupational, and physical therapy, just for you guys to know. So if anyone is interested in this, please just reach out to us. One thing that everyone could help with is at the bottom, we have the link to find the legislators that are in your district. So please, we will send out a follow-up email. And I know for speech, we have scripts written that make it very easy to reach out to them, find their email, and send an email and just discuss some of the topics that we are talking about tonight and that we are taking to Congress to try to get passed. So if you guys are interested in that, don't hesitate to reach out to us more for more details. But we would appreciate any emails that you guys want to send to your legislators that supports all of the things that we're talking about tonight. Rebecca, Molly, do you guys have anything else to add to that?
I just want to add specifically when we talk about like contacting our legislators, I would encourage all members, all non-members, all rehab professionals in the state to not only advocate for your own professional scope of practice, but to also consider adding in what you learned tonight about what the speech therapists are advocating for, what the occupational therapists are advocating for, and just see that every progression forward that each one of us has is a shared progression and will help us all continue to move forward and increase our power and our voice. When we're competing with other organizations such as the Colorado Medical Society or the Trial Lawyers Association, they have huge voice to work with, right? So my hope is that by collaborating all of us together, the voice just gets amplified and they hear from more people than they would if they just heard from physical therapists or just heard from occupational therapists. So I would encourage you to keep this kind of in the back of your mind when you write your legislators and say, hey, like, I would also like you to consider these topics as well. And here's how that's important to our patients. Here's how that's important to my practice and to other professionals in this state. So I'd like people to consider that. And then just like as a big shout out to our governmental affairs committee, I just want to share that we have over 100 PT and PTA students planning to go to the Capitol this Wednesday, and I cannot wait to share the outcome of that with all of you, but I am so excited to see that like early engagement and excitement. It's going to be an amazing event.
That's awesome.
Thanks for
That is
sharing.
awesome.
That is amazing.
Well, and I think, oh, sorry, go ahead, Molly.
Oh, I was just going to say that for our members, registration just went out for our Hail Day. So if you look in your email, you should see it from Monday's email to be able to register since we do have a limited 40-person cap on ours. So we'd love to see you there. What you got, Jess?
Well, I think to your point, Rebecca, you two are the perfect example of the DME bills. PT did that first. You guys kind of paved the way for OT, and now OT is going through it. And speech, I haven't forgotten about us. Don't worry. We already, same representatives that are sponsoring our bill for the SLPA are a part of the OT DME bill. So I've already put a bug in their ear that once, I'm sure things are going to need to shift on a federal level for this, but AAC devices can be considered DME. So that's our next. I'm in. I want to do that. You guys have already done that. Thank you for paving the way. Speech, we're next because that's something that I would love to be able to do without having a physician's signature required, because you all know just how hard that is. So I think the three together, that's fantastic. And it just goes to show how, like you said, Rebecca, when one does something, we can all benefit from that in one way or another. So I think it's really important. So thank you for sharing that.
Well, I also just want to let people know that the associations are supporting each other publicly as well. So we've sent letters in support of the Speech Therapy Association passing their bill. We're going to testify on behalf of the occupational therapists and the durable medical equipment bill. So we are just truly committed to showing up for each other.
Yeah, which is awesome. All right. On that note, perfect introduction. Thank you. Continued collaboration. So some of the things that we have been talking about in terms of how to continue all of this, we would love to hear from you guys. This is our three brains working. More is better. So if you guys have ideas, please don't hesitate to share those with us as well. Some things that we have initially thrown out and are going to try to make happen here: ongoing webinars. So for Kasha, we offer webinars once a quarter. We are going to open that up to PT and OT as well, so we can get all that information sent to you guys. And if anyone is interested, some of that may be crossover and learning some things that you didn't know before. I know I work in a multidisciplinary clinic and I learn from my PTs and OTs every day. So that's one thing that we have all decided that we can do to kind of share all of our education and all of our knowledge. So more to come on that, but the webinars are going to be open to all three associations. Rebecca, I think you want to talk about discounted conference rates?
Yeah, so one of the things that the APTA Colorado board just voted to put in place is that we'll be offering discounted conference rates, discounted webinar rates. All of our events will be open to OTAC members and CASHA members at the same rate that APTA members will be receiving as well, so that we can all collaborate a little bit more. We can share conferences, we can share our webinars, we can share our events so that we can kind of just all learn together. And we intend to hopefully have that be available for all three of our organization as we move forward. So we're really looking forward to that. I know that I just got back from APTA CSM, which is one of our biggest national conferences, and I learned from occupational therapists who were presenting at that conference. So there's so many opportunities for us to work together and increase the value of what's offered to you as an OTAC, CASHA, or APTA member in Colorado.
Thank you, Rebecca. For OTAC members, do know that we are planning to vote on this in our April meeting and would are very excited. Hope to extend the same offer. I think it's a fantastic idea and something I'm very excited to do. So another issue or another area we're collaborating in is we've already talked about the legislation and how we're going to support each other, but this includes at the federal level. There's been a lot already occurring on the federal level, from the Department of Education to the Section 504 of the Rehabilitation Act. And we plan to continue to keep each other in the loop, give each other resources of what we're hearing and what our organizations are saying, and continue to try and have one voice to at least affect what's happening in Colorado, and continue to support our organizations and our practitioners. So, very grateful for that, especially for just how much has been occurring in the last month. And then for shared events, we are looking forward to sharing events from professional development, continuing education, to also just social events. I know that the OTs are having a walk that we're doing, a Parkinson's walk in April, and would love to invite everyone else to that. And just to continue to collaborate, increase our community and our communication, and continue to connect and just establish that, of course, we all work together, and of course, we all support each other, because that is the better way.
I love it. All right. Thank you, ladies. Okay, so I think that's all that we had to talk to you guys about tonight. So why don't we go ahead and take some questions that you guys have from the chat? And
There are quite a few, Jesse. So I'm gonna just,
Rebecca, yeah, can you, I'm sharing my screen. So do you want to just pick a couple from each discipline that we have in there, and we can go over as much as we can, and the rest
yeah.
we can work on emailing out to everyone.
Well, and I will share the questions and then answer them. And if you guys want to jump into, then we can all kind of put our 2 cents in as they apply. So first question is, where can we find the resources aside from the My Find My Legislator to write advocacy letters? So we have a couple of different links for that, but we will also be sending you a follow-up email that is going to have that information in it. So if you attended this event, you'll have access to that. And the question that went along with that was, could you please provide a script that includes legislative agenda items for all three disciplines for us to use when reaching out to legislators? And the answer to that is absolutely. So I think we could draft an email kind of from the perspective of all three disciplines that includes all of that information. But the thing that I've learned from my amazing lobby team, and Eliza Schultz is here with me to help me correct me if I make any mistakes here, it needs to be personal. So we'll give you those templates so that you have like all the legislative stuff that feels like on point, but then we need you to personalize that a little bit. I am your, you know, what's the word I'm looking for? Your What's
Constituent?
the word? Like your votary. I'm like you're my representative. I live in your district. I want to introduce myself as a healthcare expert in your district that can help you weigh in on different health policy things. Here are some things I'm concerned about. And then the best recommendation we also have is to focus on how it affects the public and how it affects the patient more than how it affects you as a professional. While all of that's important, our members really want to protect their voters and our communities. So really focusing on how do these bills impact the public. So for example, with the SLPA bill, there's a huge waiting list of people who need access to speech therapy that can't get it because there aren't enough providers. So by focusing on increased access for children, increased access for students, we can hopefully sway them a little bit more than, it would be nice if we got paid more, like that type of thing. So thinking about that narrative as you personalize your letters, but we will absolutely give you a script that has all the like legislative ease in it so that you don't have to think too hard about that part. And we'll make it as easy as possible. The other thing that I want to throw out there for APTA members is on the APTA national website, there is something called the State Affairs Advocacy Map. And you can Google that and then you can click on Colorado. it will bring up every bill we're not only promoting, but that we're monitoring. And if there are any things that you're concerned about, you can actually click there and sign up to get text alerts, phone alerts, or email alerts as that bill continues to progress through the legislature. So if you're really passionate about the sports physical bill, you can sign up for that and it'll ping you every time something's needed so that you know exactly when to call, you know when to email. So that's a service that APTA National provides that helps support us as a state. And I just want to make sure people are aware of that. Is there anything you guys would like to add to that?
I would just add, I think Megan, our lobbyist, would say the same thing. And if you guys think about it, there's not many people that can't say that they haven't been affected by PTOT or speech in some way, them, their family members. So by talking about the three of us, they're going to have some kind of experience in this rehab world. So the more personalized you can make it, the better. I would agree with that. And yes, ASHA has the same thing, call to action. And I know they sent out an email last week, midweek, with all of the links to all of the things, with all of the scripts that you can send. So same, lots of different ways to get involved.
And then for OTAC members, we have been sending a number of emails. Megan, our executive director, has sent some great emails with different templates of what you can send for our DME bill. We are actually currently needing you to send a letter to the Senate Health and Human Services Committee, and you have received an email. Please go in and look at it. Great instructions along with emails and a draft template. To Rebecca's point, absolutely, please make a personal story or statement in it and tell our legislators how it affects you. It does matter a ton. And Tim Coleman is one of our lobbyists, is also on this phone call. If you have anything to add, Tim. Hi, Tim.
Hi everyone, happy to be here. Yeah, I think it sounds like the plan is to send out an email on talking points of the various legislation, which is great, since each one of them are nuanced in their own ways. But couldn't agree more. If you can find a way to make it personal to a patient that you're helping, or find a way to connect with that legislator that you're reaching out to, those stories go a long way in helping us advocate on your behalf. So thank you all for coming tonight and learning more about the great legislative work that all three of our groups are doing.
Thank you, Tim. And then at a national level, AOTA also has its own Legislative Action Center. If you just Google AOTA Legislative Action Center, you do not need to be a member, and that will have for you every relevant, pertinent, important legislative issue that's happening right now, and already has a pre-made template for you, has a very quick way for you to find your legislators, and strongly encourage you to use that and look at that. And you can sign up for email alerts. So anytime that some sort of action is being needed, they will email you. I promise they won't spam you either.
All right, our next question is more of a comment, but it's like one of my favorite things to talk about, so I absolutely cannot skip it. It says, I find it a bit frustrating to have these legislative barriers for physicians signing off on the plan of care eliminated and the ability to order DME without the physician, but I'm still restricted at the facility level. I guess I don't understand why we work so hard to influence these changes, but we're still restricted by red tape elsewhere. And this is one of my favorite things to talk about, right? Because we have top of scope, we have top of license, and we have top of facility. And I think we all want to practice at the top of our scope, which absolutely includes ordering DME. It includes having a plan of care without a physician, right? All of those things. But we can't get to top of scope unless it's part of our licensure. So in order to get to top of license, we have to advocate within our state to change what we're legally allowed to do. Okay, so top of scope is where we want to be, top of license is where we're stuck, and then top of facility lags behind both of those. But we have to advocate at each level. So we're aiming for here. Right now, we're working on top of license. And the more we push top of license, the more these top of facility changes will start to come, right? Like direct access, for example, we had to have a physician referral for so long. That was just part of the way things were. And some insurance companies, for example, still require a physician referral. But we cannot influence the facility until we change our license. And we can't change our license if we don't push our top of scope. So in this case, I'm going to just put that back on all of us and say we have to advocate within our profession and outside of our profession to move ourselves forward. And the facility level is going to be the last thing to come with it. But if we don't make these changes here, we can't get here, and this will never change because someone will always say, you're not allowed to do that. But if we make these changes, we can go back to the red tape holders and say, legally, I am allowed to do this in this state. You are limiting my ability to serve my patients and to progress this facility and our policies and procedures forward.
I don't have
Great.
anything to add to that. Rebecca, that was a
No, that was beautiful. Thank you.
wonderful picture. Thank you.
So the next question is actually about the DME bill that the PTs passed. Can PTs acquire DME without signature referral regardless of the payer? So yes, we absolutely legally can. Will that payer pay? Maybe, maybe not. We are working on figuring that out. The DME providers have raised concerns about this for both PTs and OTs doing this. We're told by private insurance that they will pay for these. Medicare pays for some, and our Medicaid bill will hopefully pay for PTs and OTs to prescribe DME. So it's a little up in the air. Just because something's legal doesn't mean a payer has to pay for that. So, but we have to start somewhere. So we're starting there, if that answers that question. And as we go through the rulemaking process and as the OTs are able to pass this bill, we hope to be able to provide you some comprehensive continuing education on how to prepare you for this change. We already have some informational graphics all ready to go for you as soon as the OTs successfully pass this bill. So we're ready for that. And then the more we learn with our payers, the more information we'll continue to provide you. But right now, we're just at the very beginning. However, PTs, you are currently legally allowed to do this. So I would highly recommend you go forth and give it a shot and then keep coming back to us and telling us what support you need.
I don't have any more to add. Thank you, Rebecca. That was great.
And then the last thing we have here, just from our lobbyist, the Workers' Comp Accreditation Sunset Bill that we're working on for PTs and PTAs will also include SLPs and OTs. So that benefit will hopefully reach all of us and anyone who's regulated as a healthcare professional in the state. So hopefully that'll be a shared win at the end of the session.
Thank you.
Appreciate it. Yeah.
Is that all the questions that are in there?
That's what I see. I'm scrolling just to double check.
Okay.
More coming.
More coming. We do have a comment that says, thank you for this. That's great. All
Our
better
pleasure.
together. So here's a question. How does OTAC plan to approach the dry needling issue legislatively? Application of physical agent modalities and therapeutic procedures such as wound management, techniques to enhance, maintain, or prevent decline of sensory perceptual, psychosocial, or cognitive processing, management of pain, and manual techniques to enhance, maintain, or prevent the decline of performance skills. That is one suggestion on how we could approach that. But they're asking, are you going to do that through the interpretation of the current language regarding manual techniques or change the language in the Practice Act?
I do apologize. Will you post that into the chat real quick?
I will. So I think the question basically, I think I just gave you too much information. Are you planning to change your Practice Act completely to accommodate dry needling or just use the interpretation of the current language around manual techniques in your Practice Act
Thank
as
you.
it stands?
Thank you. So these are great questions and things that haven't been decided. And the idea would be to change our Practice Act, but it's still very much in the very beginnings. And if you have questions or would like to know more, or better yet, would like to join our task force groups, there are some hardworking individuals to try and make legislative change on this. So please don't hesitate to email us at info@otalkco.org if you have more questions or want to be more involved. But I will certainly inform you next year at hopefully our next town hall meeting.
Molly, you've got another question coming in hot. Where
Ready.
is OTAC and HCPUF on getting the nationally approved caregiver education CPT codes into the actual billing manual for HCPUF so we can bill for it?
That's a great question, and I have no idea. But
I may be able to give a little bit of insight into that.
Ready?
Currently, HICPUF is not recognizing those codes for the state of Colorado. So I know that we are actively working on that. Although they are national codes, they are not recognized in Colorado yet. So I think that will be a collaborative effort for all of us. It's kind of up in the air and it's a bit of a gray area for even them. So we don't have a fight yet because we don't know exactly what we're fighting. But they have said that the state right now is not going to recognize them. So that will be a collective fight for all three of our disciplines.
Great. Thank you for jumping in, Jesse. And to whoever asked that, please again, once just email info@otacco.org and let us know these concerns. That way we can help you address them and know that this is something we need to fight for.
Yeah.
Jesse, can you click to the next slide so people can take down that contact information?
Yes. There we go.
And then if there aren't any other questions, I mean, we're happy to wrap it up early, but we're really excited to have had this session. See if we've got more things coming up. How many people are on this webinar just to engage the interest and support? So I'm really excited to tell you we had 73 people register for this webinar, which is outstanding. And we had 40 attend. And this is also being recorded and will be posted on the APTA Colorado YouTube page and will be sent out too so that you can share it with your coworkers or anyone else you think might be interested in that. So I think the interest is totally there. I'm really excited about it. Okay, we've got another question. Just a clarification on the OT DME bill. There needs to be specific language in the OT Practice Act to allow dry needling. DORA has ruled that dry needling is not allowed for OT in Colorado without legislative action to include in the Practice Act. There is no interpretation of the current act that allows dry needling, and DORA has ruled it illegal.
Sounds like more of a statement. All right.
Yeah, it was just a clarification.
Got it. Thank you.
And then a comment. I think this is a demonstration of great collaboration. Well done. Thank you for the information and leadership and collaboration. Awesome. Well, thank you all so much for being here. We will have this posted. We will send a follow-up email, and we hope to, at the end of the legislative session, bring you all back together and let you know what we accomplished.
Yeah. Thank you, everyone. We appreciate it.
Appreciate it a lot. Thank you, everyone. Thanks for attending.